Good morning, friends. David Wright here, and I am your host of the Disruptive Innovators Champions of Digital Business podcast. And I am very excited for my session today. I am joined by the revered Lawrence Hamilton. Lawrence, it's a pleasure to have you on, my friend.
I'm delighted to be with you and with your viewers, listeners, followers. So good morning, everybody.
Absolutely. Been looking forward to this. Lawrence, I know we see it kind of in your background there, but for those of our listeners or people who are tuning in via Spotify or iTunes, could you just share a little bit about your current role?
Yeah, got a couple of roles. The main one is Exec Vice President for the Permanente Medical Group, which is the medical group part of Kaiser Permanente that serves North California.
Yeah,
So
absolutely.
we care for a little under 5 million members, patients, and with 55,000 colleagues, 10,000 physicians, and 45,000 clinicians and staff. And extremely proud that our members live 5 years longer, typically, have 20% less chance of dying from cancer, 33% less chance from dying from cardiac disease, with a net promoter score of 86, and achieve that at lower cost than other health plans. So that's sort of why I came into healthcare, to deliver those sort of outcomes. So that's my main role. And then I have a second role as professor of practice at the Global Business School for Health as part of University College London. It's the first business school focused on health and global. So it's a privilege to help to coach, train, develop the next generation of global health leaders.
Yeah, I was actually when I was out in London a couple of weeks ago, they were hawking me on some of their courses. I'm looking at it. A lot of it you need to physically be there. So I don't. They're coming out with some more online stuff. So we'll see. We'll see. Maybe you'll end up being my professor at one point.
We can teach each other.
I love it. So Lawrence, I I'm very excited to get into that because I mean you mentioned some of the KPIs that you guys have been able to achieve within the construct of the United States, health system, or what we were able to. Because as I've traveled globally and learned more about health systems internationally, it's there sometimes you can only do so much with certain incentives or certain programs or certain. So I'm excited to get into the work that you guys are doing at Kaiser. Before we do, first and foremost, I always like to start the episode with if there was only one piece of actionable advice you might look to leave the listeners with today, what would that be?
So for me, I consider it just a huge privilege that I get to work that feeds my heart, because it's a strong sense of purpose, just how healthcare is essential to having a healthy society. And it feeds my head because it's complex. Science changes, technology changes, public expectation changes, public policy changes. So I think if you can find a role that both feeds your heart and feeds your head, then you're very lucky because you spend a lot of hours at work, and it's got to be important to you. Um, my favorite book, in very practical terms, because that may sound a little abstract. The favorite book I read
Intimate.
this is called Moral Ambition, by Rutger Bregman, which speaks to his ambition in the book is to transform idealism into action with the goal of making the world a wildly better place. And I just love that as a tagline, and it's just packed with amazing stories of things that people have accomplished that are not necessarily famous, but have made the world a wildly better place. So
I
that
love that.
idea of finding work that feeds your sense of purpose and is intellectually fascinating and curious and has an impact on a lot of people.
Yeah, yeah. I mean, that's why I got into healthcare. In truth, was to try to play that small role in affecting change, the access, and the experience. It is fulfilling, and I for me, happiness is fleeting. And for a long time, I was always trying to strive for the next benchmark in business or in life. And what I came to know is that I can't fill that hole, right? Like there's never enough. There's never enough, uh, you know, stuff, accomplishments, awards. Like it's just not that's not what fills me up. Like to your point, I get no greater joy than in being of service in the world. So I feel the most fulfilled when I'm uh, serving someone without expectation of anything in return.
Yeah, I'll tell you a quick story. I was finishing an employee orientation, and I always start with a patient story to sort of anchor us in why we're here. But I was leaving, and said thank you to the volunteer who was giving out all the packets, as a senior gentleman. And I said, thank you so much for volunteering. And he said, I will volunteer every minute you want me here. I was sort of taken aback by how emphatic that was. So I said, but why every minute? And he told me a story. He said, 40 years ago, his wife was giving birth to his daughter, and things went south. And the obstetrician actually came out and said, I'm not sure whether your wife or daughter will make it. And he had an hour and a half of utter misery. But they both came through okay. And then 20 years ago, his wife got breast cancer and had had radiotherapy, chemotherapy, but came out okay and was part of the cancer survivor program, our cancer survivor program. And he said, 2 years ago, I had a STEMI heart attack, and the rig took me to one of our other hospitals, and he had a stent put in. So he said, the two most important people, the loves of my life, are here because of you, and I'm here because of you. So yeah, I'm going to give you every minute that you want as my way of giving back. So I always get a bit emotional telling that story, even though I've told it a few times, because it's right at the heart. What a privilege to be able to impact people's lives, neighbors, community members. And it's very easy when we're busy at work to get distracted and weighed down by all of the stuff that we deal with, and you lose sight of the real fundamental of what it means to be that important to somebody's life. And then to be able to do that at scale, we provide comprehensive care to 1 in 70 people in America. Kaiser Permanente as a whole provides care to 1 in 30 people in America. That's an unbelievable privilege. And so to your point around finding something that's truly fulfilling at a deep level.
Yeah. Wow. I mean, it got me choked up a little. And it reminds me a couple things that it brought up for me. One, the art of storytelling. So I think so often when we're trying to affect change in an enterprise organization, folks get caught up in the science of it. Like, okay, we need this platform. Like, okay, let's get business requirements. Da, 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 da. And even if that's like logically and scientifically correct, and it's a necessary component of it, the art of storytelling and getting to the heart of why we do what we do, and why people would be, in it, lean into the change. I think that's where the storytelling plays a part, because particularly the 70% of disenfranchised employees within an organization, like, so maybe not those, like that 30% that's guiding the thing, but the other folks, and a lot of those folks are going to be using, and I'm just saying technology, you could substitute anything there, right? How am I enrolling them? And I think that, like, a story like that, like you pulled me in right away. And like Lisa Griffin, she's like chief consumer officer at University Hospitals in Ohio, outside of Cleveland, and she told me a similar story about, somebody who'd called in, um, to the access center to a representative there, and they were frantic. Their husband had a was dizzy, and she wasn't sure if he had fallen, and somehow the call cut out, and then um, she tried calling the person back, didn't get them on the phone, and she was kind of like shook. She went over to the nurse triage area, and she's like, "Hey, like, what do I do?" They're like, well, they'll call back. Don't, like, you're okay. But like, she was on the phone with the woman. She heard how frantic she was. They didn't have that insight. So it just, she couldn't let it sit, and she called an ambulance. And sure enough, that gentleman was having a neurological incident. He had like, if she hadn't called the ambulance, he would have died. And, I in my world, which is often, access, rev cycle, kind of, the wheels of the consumer, or ultimately the patient journey in a health system, you could think of that access center representative as just a call center person, right? Just somebody who picks up the phone. But if I enable them with tools, and I make their life easier, and I can free them to be there with the patient, and then I inspire them on top of that and say, what you're doing matters. mm, It's not simple, right? And it's not something that, like, once you say it once, you've arrived. But it's like, to me, Lawrence, that's like an example of what real leadership looks like.
I think about this a lot. I think your examples are great. I think, one of our fundamental challenges in modern healthcare is um, uh, we see many of our team colleagues will see hundreds of patients a day. So for us, it becomes completely routine. And we sit in a large organization. And I don't want to romanticize the past, because when it was very small organizations, you had examples of fantastic care, but also examples of dreadful care. And now, through having electronic health records, through having systems that support people, it's really raised the bar overall in terms of quality and outcomes. But it's done so at the risk of depersonalizing care, both for patients and for clinicians. So is there a sweet spot? I think there is, but it's hard to achieve, where we take advantage of all the systems to provide great quality, consistency, reliability, but not at the price that we still want the moment of care to feel completely personal and intimate. And I think that's, and for our healthcare colleagues to go feeling incredibly proud, feeling that they're not rule bound, that the rules are there to support them, but they free them up to actually focus on what that individual patient needs. Very quick example of that. We had one of our receptionists. Somebody came in a week after their appointment. They vaguely remembered them because they must have seen hundreds of patients since then. And the patient said, I was incredibly scared when I came for my appointment because I wasn't sure what I was going to find out. And you checked me in, and you pointed out what a beautiful necklace I was wearing.
Right.
And just that act made me feel like I was somewhere where I'd be looked after. So I want you to have that necklace, and gave it as a gift to that receptionist.
Oh
And
my
it's
goodness.
just that gap between what's routine for us and what is a significant, whenever any one of us goes to an appointment, just the degree of trepidation about what we might find out and what the impact it might have on the rest of our lives. I think our ability as healthcare organizations to respect that, both for our patients, but also for the teams that we support, so they feel able to connect with patients. The moral injury that healthcare professionals feel is often because they're prevented through our systems, whether it's denials, or an electronic health record that feels like they're spending all of their time documenting care rather than focused on the patient. Um, I think it's our obligation as health systems to try and set up healthcare professionals to be able to do their best work and connect with patients and feed that sense of why they came into healthcare in the first place.
And I think it's physicians and those like administrative types alike. And I would agree with what you said before in that, like, I don't think we're too far off, which is exciting. I mean, there's a lot of work to be done, but I see the promise of that and what's possible. I mean, there's some kind of macro, you know, economic and otherwise like trends that concern me surrounding, shortage of general practitioners and things of that nature. But that's a whole nother conversation. You reminded me, well, two things. One, there was a point in my life, I was having a conversation with, I don't remember if it was a mentor or what, but, we were talking about the fact that for a long uh, time in my life, I would go about my day and it was all about me. Like, and I would often be kind or generous or self-sacrificing even, but it was still usually about me. Like, it was still about, like, you thinking I was a certain way or getting something that I wanted from you or just so I lived that way for so long, and it was really driven by fear. It was driven by fear of losing what I had or not getting what I thought I needed, and I think New York is actually, because it ties into this conversation I was having about New York, because, like, people from New York get this rap that, like, oh, they're kinda dicks, like, they're kinda, like they're in their own world and, like, you know, they're kinda hard or rough around the edges, but the truth is that, like, I feel so many people in New York, I mean, the cost of living is so high and, like, it's so intense and high paced that, like, you have to be out getting yours to just exist. And, so I feel for those people because what I realize is, like, I wasn't connecting in the world. And, it took what it took for me personally to arrive at a place where I realize this and choose to do something different. A lot of pain, really, actually, come to think of it. But, nowadays, like, going throughout my day and recognizing that, like, connecting with everyone, right? Good. And these are people I otherwise would have been indifferent to in the past. Like, maybe I would have been nice, maybe I wouldn't have been, but now I make an effort to just be like, "Hey, how are you? Like, how's it going?" And just slow down a little bit. And to your point, like, there was this, like, the other day, I had a conversation, and I was at an airport with a gate agent, and everybody was pissed off at this lady because, like, the flight was delayed. And I was like, "Wow, bro!" Like, it's not this lady. So we started talking, and we talked about her son's name. It was like it meant son in Latin or something. And it just, like, she's like, "Wow, like, I really, like, thank you." I was like, I didn't do anything. We just connected." But I appreciate that too, right? I mean, that's I think what life is about is, like, love and human connection after all.
Yeah, absolutely. That's a great story.
Um, so Lawrence, uh, again, I do want to talk a little bit about Kaiser, but I would be interested because, you know, we connected. I was out in London. Obviously, you're not from Middle America. So, I want to hear a little bit about your backstory. If you might just share with the listeners, kind of maybe um, where you started out and how you got to the point that you're at in your career today.
Yeah. So as you insightfully pointed out, I don't sound like I come from Middle America. So yeah, I came from the UK originally, childhood there, and then I was finishing up college, and at Oxford, the hospital is on the top of the hill, and it was late at night, and it's the only building with all the lights on. And although this sounds cheesy, it happens to be true. My epiphany was that the lights are on because people get sick any time of the day, and the building is full of people who are sick at their most vulnerable in life, but it's also full of people whose vocation in life is to care for others. That felt like what I was searching for. Is kind of, I'd done politics, lots in economics. I was interested in how society worked, and this idea of working in an environment which was a sort of a microcosm of a healthy society. So that
Mhm.
led me to work to get a job at the NHS has a fellowship program that's sort of for recruiting and training future senior leaders. And I didn't know, frankly, whether that was going to be the thing I wanted to do forever. But I very quickly found that what I said earlier about feeding your head and your heart, um, healthcare is just constantly evolving and fascinating. And um, how do you transform care, take advantage of new technology, but also how do you inspire everybody from the janitor to the pediatric neurosurgeon, so they're working in the same direction? So I never got tired at all. I didn't have a blueprint for what I wanted to do, but everything seemed interesting. So I did a number of jobs with the National Health Service. I set up a consulting company, and then by a circuitous route, got the opportunity to go and help lead an organization in Tanzania and East Africa, a not-for-profit health system. So I did that for 5 years. That sort of opened up my world and my family's world. I had three children at that point, 1, 4, and 7 when we first moved to Tanzania, and them going to an international school just opened up their world in a wonderful, wonderful way. So at the end of that, said where in the world do we want to be, and also which health system comes closest to what I'd create if I had a blank sheet of paper. And that led me to apply to Kaiser Permanente because of that commitment to keeping people healthy, um, rather than benefiting when people are sick. Um, and and then just a piece of luck, really, because you can imagine a British, a resume arrives on your desk from a British guy working in Tanzania. Um, yeah, my
It's
guess
like, is
is
this a scam? Or is he trying to get my
exactly,
money?
exactly 999 times out of 1,000. I think I'd have been in the trash can. But fortunately, it happened to land on somebody's desk who had done some international work, was open to it, and then was senior enough for us to sort of navigate the whole process post 9/11 about how to uh, Department of Homeland Security, Department of Labor, etc. Anyway, long story short, after about 8 months, managed to come and join Kaiser Permanente. That was back in 2005, and I'm now on job 6, mostly in California. But during the pandemic, I went to Washington D.C. to be the chief operating officer of our health plan there. Um, and then back in 2023 to this role. So it's never got dull in the slightest. It's always been exciting, and the ability to move between different roles and contribute in different ways and learn exercise different muscles and learn different skills. Um, and as I mentioned at the beginning, now the opportunity to combine my current role um, uh, with the academic role. So that's my pathway, and feel
That's super cool.
incredibly lucky to have had roles that are anything but boring, and you make wherever you land, making a modest contribution to try and make it a bit better than how you found it.
Yeah. Well, it makes sense to me that someone with your aura sounds kind of woo woo, but I mean, but your aura to, affect change and go amongst this huge medical group and impact the lives of so many people. I mean, it makes sense to me. The Tanzania thing is very cool too. I mean, my daughters, as I think you know, are uh, 3 and about to be 5, and then 1 on the way. So not so far off from your trajectory, and I very much want them to be international, you know, what's the term? citizens, international citizens, or citizens of the world, right? Like I I think it's and admit their school does a very their the school that Gracie's in, Callie's in public school now, but like they do a very good job of like teaching them like about Chinese culture and Jewish culture and like they're I think they're on their way, but I'd love to travel and like spend some time in other countries just because admittedly like there's so much that I don't know about so many things, and each day I try to learn something new about again something I didn't know, but as
Yeah, I
much
know
as I could do to set.
you like to bring in practical tips for your audience, and just a couple of things I think that would that reflect both of what we're saying is one is, I think particularly as male leaders, it's very often when people talk about their professional life, it's completely the professional life. And actually standing back and recognizing that whatever you do professionally has to make sense as a family. And, how many people look back and say, I regret that I didn't spend more time at work. I just spent too much time with my family. Yeah. Zero people say
Nobody.
that. And so trying to make moves that make sense for one's family, the people that actually care for you most, as well as having a fulfilling professional life. And those things happen in balance. Within KP, I remember I did a job that enabled me to drop off my son at middle school, no, at elementary school, and that the older one went middle school, and so there was about a 20-minute gap between their starting times. So I got to play in the sandpit for 20 minutes with my son most mornings. Totally priceless for me. And then, of course, when he went to middle school, the last thing in the world he wanted was his dad hanging around. So I got dismissed. So then I did a job that required an hour's commute. And I look back, and often these things make more sense looking back than they do in the moment. But just think, for my period, for where I was at in my life, that 20 minutes was totally precious. Um, and then when they moved on and they had different interests and they wanted to talk to me at 11 o'clock at night rather than 20 minutes in the morning. So having that blend. And then the second tip, I think, is around upside versus downside. When I look back, we've made some decisions that in retrospect look quite big, like moving to Tanzania. But at the time we said, okay, we're not going to burn any bridges. If it doesn't work, then we'll come back to London. We love London, and we'll pick up where we left off. And it'll have been an interesting adventure. So basically the downsides felt fine, and the upside was full of possibility. And I think whenever I've kind of stumbled into making decisions with upside that's full of possibility and the downside doesn't seem awful, then go for the upside. Because definitely, as you said, I remember listening to my kids chatting about where in the world they wanted to live. And if we'd stayed in London, that just wasn't a conversation, to be able to go to a school with 16 different nationalities and it's wonderful to create that sense of possibility.
Yeah. And I think for our listeners, like to me, what I hear is using that framework that you laid out to lean into the courage of making that decision. Cause it is a courageous decision for you and your family to make because there's like a risk there of sorts, right? Or rather an unknown, right? Like, had you been to Tanzania, or I imagine some of the family hadn't been to Tanzania yet, right? So like, what will it be like? Like, we just don't know. And I think there's so many things in life that, maybe aren't as, big as moving to another country like that. But it's not even like, you don't even need to compare per se. It's like whatever it is for someone, I think using that, kind of framework, and then just leaning into it, I think is a great practice. And another thing that you reminded me of too is mm, how much I've benefited from mentorship and I mean therapy, to be honest, business coaches. Like I've done a lot of work, personally, professionally, and otherwise. And I like how you kind of like, mentioned the family, work dynamic. I forget if we talked about From Strength to Strength, by Arthur C. Brooks.
It's a great book.
Yeah, yeah, but I think he mentions at one point too, like the fact that like, yeah, no one was ever on their deathbed and like being like, oh, I wish I worked more. They're usually like, if they were that striver that strived to that like dying day, they're like, oh shit, I wish I had more love and connection in my life. Really. Mhm. So yeah, it's something that I look to stay mindful of nowadays, and it's fun. It's interesting because a number of years back when I like, heard this from folks who had gone before me and done the work personally to, get to the point that I was at and blah, 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 blah. I start employing these philosophies and kind of building them into the ethos of my companies and stuff like that. And, we start seeing more success than we ever had before. Like it was, and we weren't even trying for the success anymore. We were trying to serve. We were trying to do the right thing. Like we were connecting with people. And, it's just wild. I mean, of how those things work. But even when we weren't, I think, and this kind of leads into my next question for you, like we had situations that were very uncomfortable, right? That either required us to have uncomfortable conversations or were like we had a legal issue at one point, or we had like whatever. I had some personal issues, but we didn't um, years ago I would have been like freaking out, like kind of like just very scared, really. And that's not to say that I didn't experience some level of like, "Ooh, wow." But, um, the truth is, like, things were happening. I mean, and it goes back to what I was like, I can only control so much. So, like, okay, this is the situation. Let's talk about it with some people. What's the next action? We step forward, and that's all you can do. Um, is there a Is there a time, and either like in your time at Kaiser or prior to your time at Kaiser, where there was kind of a time where something, either a project failed or you went through a difficult time personally, professionally, or otherwise, but you took away kind of a perspective shift or a lesson that now looking back, kind of like we were talking about before, that you see as something that really helped shape the leader that you are today?
Yeah, I've had within healthcare in my career now 13 people that I've worked for. Um, and uh, two of those 13 people, it didn't work out at all. Um, with the other 11 or 13, fortunately, I was lucky enough that we got on really well, lots of mutual respect. It felt great. I learned a ton from them. And it was sort of, what more can we do together? And so that gave me the hubris, I think, that I felt that I could work with anybody. And when I look back, there were two people where it just didn't work. And I got filled with sense of failure and and questioning everything that you do because everything you try doesn't seem to work. And when I reflect back, I internalized a great deal and sort of went down a spiral, really, where then you start to make less good decisions and behave in uncharacteristic ways that aren't true to who you are.
Right.
Um, and finally, in both cases, but from a place of that I didn't enjoy being in at all, or sort of I don't know, from a position of extremist, I finally took agency and took actions, walking away from one job completely, um, and just saying, "Oh well." And fortunately, I've got a wonderful partner who just sort of said, "This is making you miserable. Let's go and just live on our savings for a bit." Um,
Yeah.
and just looking back, that action of agency was actually ultimately the power that you have at the moment when you feel most powerless. And at the time, the walking away felt like failure, but it was actually the turning point of. And I remember a coach saying to me, sort of, when I was recently coming out of that situation, one of those situations, just sort of saying, "Oh, don't spend time on it. You just weren't a fit. That was that was it. You aren't going to be a fit with everybody. Um, let's move on. Let's find a good fit." Um, which felt kind of brutally, given the swirl I'd been in, the
Mhm.
simplicity of that and the obviousness of it, sort of seemed almost insulting, but was actually the correct insight. So, with the benefit of hindsight, as I say, no fun at all at the times that happened, but with the benefit of hindsight of saying, "Oh, I'm really curious. I want to keep trying things. I want to keep running at big problems that are, cha- with a, when I remember being in a big room and the question was, what are you most proud of?" And the common factor was when people took on big enough challenges that there was a genuine risk of failure. Those are the things that we find most fulfilling. If you flip that round, by the fact that there's a genuine risk of failure, it probably means that 2 times out of 13, you're going to fail. And my reflection is I would
At
rather be,
least.
exactly, if you're lucky, I would rather live my life. And everybody's on a different sort of continuum about what they find fulfilling. I'd rather charge at big problems, knowing I'm going to screw up a percentage of the time, and when I do, it's going to be painful and miserable. Um, uh, but I'd rather have a go and than not have a go. And particularly in healthcare, but I probably in every field, there are big problems, opportunities to do things better. And so that's what I've tried to discern from it. Now, I don't doubt that the next time I try something and I screw up, that realizing this won't make it any less painful. Um, but I hope that I come out of it and just say, okay, let's get back on the horse and have another go. Um, so that's my, in terms of challenges, that it doesn't always go your way. You try your best and you keep hammering at it from different angles and learn from that. But in the end, sometimes it's not going to work out,
Yeah. I
particularly
mean,
around
and
that
I've had,
clash of leaders. Some people just value different things in leaders, and that's okay. That's our rich and diverse world, and it won't always fit. Anyway, sorry, you were going to say.
no, no, I appreciate that. And like, I appreciate what your business coach said when he was just like, oh, well, you weren't a fit. And like, I think like I could see how some people might see that and like you in that moment uh, might see that as like a little harsh or whatever, right? But at the same time, I think there's something to be said in business in general, and not just like in that situation, but with situations like that, just being honest and direct and matter of fact. There's a
You're
lot of
right.
moments
It was a
that's
it was a gift.
right.
Um, Dancing around it wouldn't have been nearly so helpful.
Yeah, and and kind of taking the emotion about it out of it, and because it wasn't about you being bad, right, or good. It was just like that wasn't a fit. Period. Right. Let's move on. And there's just been so many experiences in my life, right, that in the moment were mildly or extremely painful that now I'm extremely grateful for. So that's all just to say that if anyone's in the muck and they're going through it right now, like between jobs or whatever it might be, I would just encourage you to keep talking to your network, keep, reaching out for help, right? That's another thing that I had to get better at was because I always wanted to just do it and make it happen. And like, I grew up in that kind of environment where you push things down, you keep your head down, and you just like barrel on. And I had to just get better at asking for help too. You
Totally
know,
agree with that. And in a way, it's the pride. If you're lucky enough to be relatively successful, then you don't exercise the muscles of apparent failure often enough. And so it comes as a novelty. And exactly as you say, the reaction is I'm bad, um, rather than pulling back from that and just finding a place where there's a better fit. I think Peter Drucker said we spent too long trying to help people become the perfect all-round person, leader, manager. And actually the biggest, given that that's impossible, we are who we are, the biggest gift we can give somebody is to help them understand what their superpowers are, their particular gifts, and then help them find roles in society that value the particular gifts they bring. That's such a valuable insight. And um, I remember doing some work on strengths-based leadership, and somebody who I had the utmost respect for came up afterwards and said how she, throughout her career, had spent her whole time, her interior monologue was all about her failings. There's such a gap between how the rest of us saw her as this incredibly talented person and her interior world of failure and doubt, and the ability for her to see how we saw her and then focus our energy on the things that we thought were just fabulous. It was a joy to watch her sort of emerge from that and start to play to her strengths.
100%. I mean, and I think that this kind of dialogue is often just not had at a lot of organizations, right? Like it just doesn't happen sometimes, and it should, right? I think that, I mean, that example you just gave, I mean, to be able to support someone who's going through that kind of situation with that kind of internal dialogue, I mean, I've had that internal dialogue. So I'm uniquely qualified to help that person, right? And identify with what they're going through. I think when we can identify with people who have gone through similar situations, it actually really helps in kind of walking through whatever that is, because the person doesn't feel as alone. They don't feel like it's just them going through that. Because my mind can tell me that it is, right? Like
Right.
that this is unique to me, right? And what you said before too also reminded me of the significance of leaders cultivating an environment where people can feel comfortable to fail, right? And to work through things and pick themselves up and keep going. So yeah, great insights. I do want to shift gears. You know, we talked about in the beginning. I mean, we've had so many good things to talk about. But your current role, right? So you're currently, EVP at Kaiser Permanente. I mean, when we kicked off the episode, we talked about impact and, why you got involved and, curious to learn a little bit more about your vision for the organization, based on some of the things that we're looking to see happen in healthcare in general and healthcare in the United States. Maybe some of the key initiatives that you're working on. Just looking to get some insight as to what you guys are up to over there.
Yeah, happily. So at a global level, I said that I was very proud about 20% less chance of cancer, 33% less chance of cardiac, 5 years extra live life. I think the challenge going forward is how might we continue to improve so that in every major condition, we reduce mortality by 30%. And we extend that years of life, healthy years of life further. Health equity is a major part of that, because we know that the US, when we compare globally, does appallingly compared to most wealthy economies.
Right.
But when you dig into that data, much of that is associated with health inequity. And I'm really proud that our board, the TPMG board, has five KPIs that they track. One is our people, one is care experience, one is quality, one is our overall financial health, and the fifth one is health equity. It's a real statement of intent around the importance of that. Secondly, 86 net promoter score is great, but how might we make that over 90? And we know that whenever we're a member or a patient receiving care, there are points of friction. I was talking to a friend the other day who got a discharge instruction that was 2 pages of dense type, where the nurse had crossed out a bit and handwritten some things in with abbreviations. And just they as a family were trying to decode this and anxious about their relative that had just got home. That's a tiny, tiny example, but how many thousands of times a day do we create points of friction for our patients and members? Because we can't put ourselves in their shoes. So we're doing a lot of work around care coordination. We're very proud historically of our chronic disease management programs for diabetes, hypertension, heart failure. But when we talk to our members, they say, sometimes I get confused because I get phone calls from multiple people a day asking about my health. So can we improve our net promoter score? And then two more areas. We know that the number one barrier to getting great healthcare today is affordability. So how do we take advantage of technology and other opportunities to reduce the total cost of care without compromising quality, without compromising care experience? I feel absolutely full of optimism that there are pathways for us to deliver significantly more affordable care for our communities without compromising quality and experience. And then the final thing is that's all very much focused on our patients, but also for our health professionals. We know that there are already healthcare workforce shortages that are likely to grow, particularly in primary care, as you mentioned earlier. How do we create the environment where the best health professionals can't imagine working anywhere else because they get to do their best work with us? And we're evolving. We did a lot through the pandemic and pre-pandemic actually about wellness. And what we're hearing from our teams is while they appreciate that, the things that actually drain their energy are the daily, can I do my best work for my patients and with my team? So things like, I'll mention one technology, ambient listening. We were very early adopters because for years the computer has stood essentially between the health professional and the patient. And we've loved the way that ambient listening puts that to one side so that the health professional and the patient can talk much more directly and both really value and enjoy that, but still capture all the documentation we need to in the background in a safe way. It's saving on average an hour per day for our physicians of what we call pajama time. Evening after the kids have gone to bed, catching up with documentation through your day. So that's an example, but a big opportunity. So great outcomes for patients, great care experience, making care more affordable, and creating an environment where the best health professionals get to work. That's at a big picture where I think we can continue to define what the best health systems are capable of doing. If I go to a little bit sort of less high altitude, some of the things that we're very focused on are two areas I'll mention. One is we know with the demographic change, we've got more seniors. You know, it often strikes me as ironic that we've got so much change in the world, AI, etc., people, and yet demographic change is the most predictable thing in the world. We've known it's coming for years and years and years, and yet we are societally ill prepared. So what does it take to deliver exceptional care to increasing senior members? There's three impacts. One is more people retiring than entering the healthcare workforce. So that's why the emphasis on creating the best place for health professionals to work. That's actually the near-term impact as people turn 65 and retire. As people turn 65, their healthcare needs don't really change dramatically for most people. But 15 years out, as those people become 80, significant impact. So what do we have to do to deliver care that's coordinated and seamless for people with multiple chronic conditions and help care for them at home, keep them as healthy as possible? We like to think of ourselves as trying to create a blue zone movement for our Kaiser Permanente members. And then lastly, we know that at least in America, those programs are government funded and the funding is lower than for commercial members. And so it goes back to my question about affordability: is how do we transport care so that it's lower cost without compromising quality and care experience? So that senior population is one big problem to solve. The other is at the other end of the spectrum, what we call winning the next generation, where we know that 18 to 40-year-olds have much lower trust in the health system. Often, some of our research that they see that the established health system as the place of last resort for where they go to get help, input, TikTok being number one. So how do we, and that often when they do contact us, they feel that we are judging them, that they aren't as sick as some of our seniors. And so they're the sort of worried, well, and so we need to respect where members are at, whatever their age, and meet them and meet their needs. So that means having much better digital health. What we've learned is that younger generations both want digital health as a first portal, but interestingly, they also value much more than any other generation having a trusted partner who can help navigate in a world where they're being deluged with all sorts of information. A trusted expert partner who can help them navigate the healthcare world is more valued than any other generation. So we need to do both a great digital experience to make it easy to get information, get support, but also provide you with a partner, whether it's your primary care physician or a mental health therapist. So we're working hard in those areas. And then we know that younger generation really value, as I said, that primary care interface. They really value mental health services in a way that prior generations have not. So we need to elevate those services. They really value reproductive health in its full, from sexual health through to young families. Really value musculoskeletal health, the skiing accident, the sports accident, etc. So both physical therapy and sports medicine, and really value dermatology. Was the one that I wouldn't have guessed, but once you said it's kind of intuitive. So we're being very intentional about trying to make sure that generation feels how much we care for their health and respect however they feel about their health. Is we need to be their partner in making sure they can lead a healthy life. So both ends of the spectrum, our seniors and winning the next generation is where we're focusing a lot of our energy to really transform our care.
That's brilliant. I mean, I love it. I love like it's so thoughtful. Mhm. It's funny. I smiled earlier when we started talking about the primary care and GPs because I come to find in the UK they call them surgeries,
Yeah.
and then like the queue of appointments the doc has for the day are also surgeries. And surgery is also technically surgery as well. So I was, you know, we talked early on about like, well, for me, like doing something that's challenging, right, and starting to work in the NHS for me, like learning just constantly about a new, entirely new system of delivering care has been like not insurmountable, but just like, incredibly challenging in a great way.
Yeah.
But I digress. The vision you guys have, I think is fantastic. The one question that it did bring up for me was, do you think, Kaiser is an integrated, health system, right? Do you think being an integrated health system like makes it easier for you guys to achieve some of these goals, and um, particularly with the health outcomes, is there anything you can point to specifically that you guys did that, you know, um, other health systems should be imitating or trying to implement? Not to give away your secrets, but just like at a more broad level.
No, I'm totally happy to share, and it is true. I think our by our integration, the fact that we're capitated, so we do well when patients are healthy, in contrast to most of the US still, which is based on fee for service. So, I've talked to a CEO recently who said, thank goodness it was a terrible flu season because that meant I had heads in beds that made my hospital viable.
Mm.
And at some level, it's sort of shocking for somebody to essentially celebrate lots of people getting sick.
Right.
I also get the reality that for that hospital simply would not be viable in our current funding system. So it's not like
Of course.
that person is individually immoral. It's more that the person's working in a system that is designed so appallingly. Um,
Exactly.
so can we, can we redesign our health system so to reward keeping populations as healthy as possible? Has been remains, and for all of the talk of value-based care, that was previously accountable care, that was previously, we've had many iterations in the US of recognizing this problem, and the skeptic would say, um, we've had very little success in really changing it dramatically. I think if you follow the dollars, still people are building bigger and bigger hospital towers because they believe that with an aging demographic, more and more people will need hospitals. Um, we know that doesn't deliver the best care. And instead, trying to minimize the need for hospital by providing great primary care is abundantly proven to be a better return on investment for a healthcare dollar for society as a whole.
Right. Or like
But
in the UK with community care. Like that's something that doesn't really exist in the US. Like it does in certain senses, but not in an institutional way, where, for example, earlier today, Lima trudged to East 68th Street in Manhattan from Brooklyn to go see the OBGYN at New York Presbyterian. Whereas, like in the UK, a nurse practitioner, someone would be coming to our home to visit with her leading up to the pregnancy to, check on her and make sure everything's okay. Now, granted, there's no equipment in the home, right? So if you need to go in and get an ultrasound or something like that, of course, but like there's certain things where that's like so appropriate, I think,
totally, and I think many more things are becoming safe to do at home,
right?
or safe to do locally, or safe to do digitally.
Especially with
In
wearables now, like the intersection of like what we'll be able to do with like analytics from wearables or ambient technologies, not just ambient listening, but like, ambient video and just, I mean, the possibilities are endless. But to your point, if we don't have a system that will basically paid for that,
Yeah, if you stand back, I think you
tricky.
can see two trends in the US health system. On the one hand, there's been this massive consolidation of hospital systems, of health plans. We know now there's the big five for-profit health plans were very, very dominant, and the way that the provider system has reacted is by trying to consolidate to have equal power.
Power,
Uh,
yeah.
so we had consolidation on the one hand, which has largely been about just have you got enough power to protect your slice of the cake? And on the other hand, you've had this extraordinary fragmentation with lots of point solutions, typically new technologies, new startups that are sort of chipping away. Um, Unfortunately, can lend to fragmentation.
Mhm.
Uh, uh, and so, can we take advantage of the innovation that's happened within that fragmentation, but put it within a platform or a system where the pieces integrate? And most importantly, go back to what we said earlier about what's the kind of business model behind it. Um, if it's simply so many startups, I think, are playing sort of arbitrage around carving out one little niche where they can do something better than the incumbents. It's not at all clear that it's actually adding up to better total population health and at a better total cost of care. Uh, and so, can we, as a system, as a society, find a way to take advantage of all of the what technology is making possible, but also integrate it from a patient's point of view, um, motivated. The real risk is that technology makes a really awful system just a little bit more efficient and a little bit faster at doing things that aren't actually driving the outcomes we want to see from a health system. Within KP, the work we're doing, you may have heard we created an organization called Ryzen,
Mhm.
and it sits in parallel with the traditional Kaiser Permanente where everything's integrated. And the whole idea, people say to me and to other Kaiser Permanente members, we love what you do. Why have you not been more successful at spreading across the nation? And although we're proud of looking after more than 13 million members, the flip side of that is it means about 95% of Americans don't benefit from our care and our outcomes. Risent is one of our vehicles for trying to make sure that what we do is relevant to um, fragmented markets. So we've been very intent in saying, yeah, our Kaiser Permanente model is all about integration. Most of the US has multi-payer, multi-provider
Right.
fragmented systems. So in Risent, we partnered originally with Geisinger joined and Cone Health joined, and they live in
You
much
guys bought Geisinger, right?
yeah, yeah, they
And did you buy Cone Health too?
yeah. So they're the two organizations now that are part of Risent, the kind of holding company. And the ambition in Risent is to translate what we do in our integrated system into a multi-payer, multi-provider
Multi-payer.
system, and
That's
actually
super
making
cool.
quite good progress in helping clinicians, teams, hospitals in that evolution from where they start, very fee-for-service, very fragmented, towards a more integrated population health platform. Um, so that's some of what we're focused on trying to do at an organizational level to really transform the system to be much more value-based and drive population health outcomes.
I love it. Mhm. It reminds me, we only have a few minutes left here. The other day, I was having a conversation with the chief, I think he's the chief medical information officer or chief medical, and Richard Zane. He's at UC Health. He's a chief, really brilliant guy, lovely guy. I think he's an MD. But that's a personal joke, everybody. But so we were talking about the fact that if someone solves a problem already, because they're a very innovative health system. They're only like 8, 9 years old, so they don't have a lot of the legacy baggage that a lot of other health systems have. So they've been able to build this thing based on what they didn't want it to look like, and that's benefited them in a big way. Still struggle with a lot of the same things that health systems struggle with at all different levels, but one of the things that I really appreciated is they're very keen on, like, if there's a problem in front of them that someone has already solved, like, let's not spin our wheels trying to figure it out. Like, let's leverage the best practices and then focus on innovating surrounding the problem that hasn't been solved yet.
Mhm.
Mhm. And I think so often I see health systems kind of iterating on these things that, again, some health systems have solved. And what I also see is like it's different for each health system, right? Like some health systems have some some health systems have advanced in one area and not another, right? So how are we like sharing that knowledge? So that's all just to say that I think that what you guys are doing is fantastic, because if we could bring that to a multi-payer, multi-specialty setting, I think that's brilliant.
Yeah, it's that combination of being proud of what you have had some success doing with profound humility and curiosity about where you haven't. And so we're learning, um, but with a real clarity about what the ultimate destination is, what the mission is, so that we're not drawn into so we're drawn towards that population health. How do we make sure, inclusive of all of our community members, they benefit from the best possible chance to live a healthy, fulfilled life?
Yeah, I always say the older I get, the more I learn, and the less I realize I know.
You're not
Funny,
alone.
another Lawrence, this has been amazing. Oh, the last question I have for you. You threw me off. I didn't even stay on script today. I was all over the place, and I love it. I really love this conversation. If you could go back 5, 10, 15 years in time, what advice would you give your younger self?
That's a great question. I think it connects to our earlier conversation about strengths. I wish I'd been clearer in my own mind uh, about my own strengths, but then much bolder in identifying other people with complementary strengths. Um, Particularly that emphasis on identifying your immediate team colleagues. And that's been my learning journey over the last 5 or 10 years, is just seeing just how brilliant and different colleagues can be. And when that works well, then the sum of the parts is the sum is so much greater than the parts. It's exciting.
Agreed. And great practical advice to end the episode on. Lawrence, thank you so much for joining us today. I really appreciate it.
I love the podcast. Thank you, David. It's been a privilege to join you and your audience. Thank you.
Absolutely. And to our listeners, thank you all for tuning in. We will catch you all next week.